lot of the diagnoses I make, yes, it's medicine, but it's also just having people trust you and tell you the truth about what's going on in their life, right? And the weight they've gained, and maybe the diabetes diagnosis that they had are all because they were depressed about a loved one dying and they couldn't get a hold of it. And the one thing they leaned on is food. And so having that person really trust in you, that helps you be able to solve their problem.
Hello, everyone. It's Dr. Erkeda with a very fantastic guest, Dr. Gina Blocker. We're just going to give you an opportunity to tell us a little bit about yourself and your journey to medicine.
Hi, Dr. Erkeda. Thanks for having me. I'm so thankful to be on a podcast to be able to share a little bit about my journey to medicine. So I'll just get started with how I started. I am a native of the East Coast, hail from the Philadelphia area, and originally applied to medical school and did not get acceptance the first time I applied. And then retook the MCAT and was pleasantly surprised to get an acceptance to the Philadelphia College of Osteopathic Medicine, and went ahead and finished 4 years there. In my third year of medical school, joined the military. So I became active duty in my third year, finished in my fourth year, and then went on to pursue a residency in emergency medicine through the military. So that took me down to Texas. Sunny, hot Houston is where I live now, but it actually took me just north of Austin to Darnell Army Medical Center. So I finished a 3-year emergency medicine residency program there, and then went on to work in an academic hospital at Fort Bliss in El Paso, spent 6 years there, active duty military, and then got out of the military and joined the Baylor College of Medicine team at St. Luke's in the Medical Center in Houston, Texas. And then from there, practiced community emergency medicine, really enjoyed my time. This is my 15th year of practice. And here I am. I'm a mom of 5 and a wife, a daughter, sister, and a friend. And I've realized that medicine is quite a journey. And instead of a sprint, it's more of a marathon with different legs of the race. So I'm excited to be where I am, and I wouldn't be here if it hadn't been for where I had been. So that's pretty much it.
Thank you for sharing your journey and being so transparent. A lot of listeners are pre-meds, and a lot of times we'll get information from people or outreach and things like that. And a lot of times we talk about our success, but a lot of people don't get into medical school in the first try. So I'm glad that you mentioned that, which a lot of our other guests have mentioned as well. So for you guys who are in the application phase, like, do well, all of those kinds of things, but it's okay to reapply. I also love that you mentioned your experience of doing military medicine, because a lot of students have questions about that in terms of the scholarship opportunities and the lifestyle with that. So before we get into a few more questions about like what brought you into emergency medicine and all of those kinds of things, I'd love to hear about your experience in signing up for the military and training while you're in medical school.
Sure. So you actually are in a reserve status as a student. So you're non-deployable as a student and a resident. You're non-deployable. So that really gives you the opportunity to pursue, a really excellent training program without fear of being deployed or taken away from your trial during that time, right? So as a medical student, you transition into, a resident, and you don't have any threat of that time period during your training to be deployed. So that was really my biggest concern with going active duty. But the absolute best part of my career is taking care of soldiers and their families. And so as an emergency medicine physician, the front lines is the front lines in any, in any guard that you're in, right? So whether it's in an inner city, in a rural community, downrange, the military, those front lines are so important. And I really had the opportunity to lead, become a leader in my department, become a leader amongst my colleagues, and to train other residents, right, for military time warfare. So it really, really, and you're training, family medicine doctors come through, surgeons, specialists, those kind of, and we're all soldiers. And that really kind of leveled the playing field. and made it really fun to be able to train with my colleagues. So, learning all the medical military things and doing all the basic training and all those things really, really added to my armamentarium, as a physician and as a leader.
That's awesome. So what made you choose the field of emergency medicine? There are so many different options for specialties. And I know a lot of students, when they enter medical school, they may think they have it all figured out, and then they get to their different rotations and they're like, okay, maybe let me try something else. So what made you choose emergency medicine?
I will tell you, I loved being able to make a difference in that moment. I wasn't the kind of person that wanted to change a medication and see what happened months later, and I think that there's such a special calling for somebody who's able to make a change and really connect with someone and meet them right where they are in that moment. And I knew that's what I excelled at, right? I knew I could sit next to somebody and they could tell me and they could trust me. And people always said to me, I can tell you anything. I can tell you absolutely anything, Gina. And I really transitioned and translated that to my life, not just as a physician, but I think it's really important to be able to connect with people and make a change in their life. We just never know what people are carrying. We never know what trials, a lot of the things I do, a lot of the diagnoses I make, yes, it's medicine, but it's also just having people trust you and tell you the truth about what's going on in their life. Right? And the weight they've gained and maybe the diabetes diagnosis that they had are all because they were depressed about a loved one dying and they couldn't get a hold of it. And the one thing they leaned on is food. And so having that person really trust in you, that helps you be able to solve their problem. Right? Yes, it's a medical way to treat diabetes, but to get to the root of the problem and have that person really be able to confide in you is really, really something very special. I loved procedures. I loved being able to sew lacerations and put chest tubes in and really just kind of change someone's trajectory. I love being able to do the sleuth, the trying to figure out behind the scenes about what happened at the scene. This patient was found down at home and was brought to me unconscious. Well, what did the scene look like? It kind of gave me that detective sort of investigative approach to medicine. And that intrigued me. That being able to perform that procedure, being able to crack the clue in that medical case really, really kind of made me excited about getting up and going to work every day. And it doesn't feel like work to me. At that point, it didn't feel like work to me, right? It became a love. It became who I was. And one thing I will say to prospective physicians, medical students out there, be okay. Let it change you. Let the journey change you. Let it have an impact on how you live your life. Let it have an impact on the things you enjoy, but don't let it be your everything, right? Love what you do and be very good at it, but know that you have gifts elsewhere. So let it change your life and realize what's really important, and don't miss out on answering what's really important to you deep down. Yes, I love practicing emergency medicine. I absolutely love getting up to go to work every day in the department. I never know what I'm going to see. I never know who I'm going to meet. And there are no chance meetings, I'm thankful for the opportunity. But the first and foremost thing that I love about my job is that it gives me perspective as a mom, as a sister, as a friend, as a woman, as a Black woman. It gives me perspective to live the life that I want to live, right? And it helps me realize what's important. And I think I didn't realize that until my 8th or 9th year of practice, when it was really hard for me to get up in the morning to go to work. Or I dedicated everything and I was so tired. Or I was always picking up shifts for everybody. And I was always the one that everyone called on. I was trying to fix everybody's problems. But then I realized I had to answer my own self at the end of the day. What made Gina happy? And I will really kind of implore upon medical students and residents, don't lose who you are. Don't lose your hobbies, your things you enjoy to do. Spend time with your family. All those things are important, as well as pursuing a career in medicine.
I love that. And you brought up some really great points. One, being a physician is one of the most intimate relationships you'll have with another individual. They tell you things that they don't tell their family members, their partners, right, all of those types of things. So building those relationships and having that intimacy is a gift. Also, you mentioned And I love emphasizing this as well. Like, being a doctor is a part of who you are, it's a component, but it doesn't define you. So don't lose yourself in those titles and all of those things, because they can come and go. All of the different things have happened in different people and different physicians' lives. So stay true to who you are and have those hobbies, have those interests and other things, and engage with your family, because yes, you can take a lot of shifts, but the people who will notice or miss you the most are your family members and your friends.
That's right.
So definitely pour into yourself.
Right. And for the prospective moms out there and women that want to have families, get married and do all those things, it's different for women in medicine still. And I have to say that out loud. It's different for us still, right? I was in a residency class of 7 men and me, and we training that. And I was the first African-American resident to graduate from that program, female Black resident in emergency medicine in that program. After like 40 plus years, I was the first one. And it's different for us. When we have kids, it's still different for us. When we take maternity leave, it's still different for us. When we breastfeed on shift, it's still different for us. When, we come back postpartum blues because we only took 5 weeks of maternity leave, it's different for us, right? And so allow yourself some space to be able to say, it's different for me. And then don't be afraid to ask for help when it gets hard, because it's going to get hard. And somebody's been there before. Identify someone that you feel like you can trust in your program. Identify somebody who you feel like can hold your hand and walk the journey with you. And people always say, get a mentor, find a mentor. It's hard to find a mentor. It's hard sometimes to find a mentor, but I implore upon you to look around, look at somebody that maybe looks like you, or maybe, you've asked a friend or somebody that you've trained with, or someone that trained you in a rotation or helped you write a letter of recommendation. Ask them that you can ask questions. Ask them to spend a lunch break with you or grab a coffee and just pick their brain about things that you're worried about, things that you're concerned about, things that you're apprehensive about, things that upset you, or things that you see maybe, concerning moving forward. There's going to be times where you just need someone to say, this is how it should go, or this is not how it should go. And then you want to feel comfortable with their responses. So, find a mentor and keep them close.
I agree with absolutely everything that you said, and it's very important. And we've had a few episodes on this for the women who have to think about family planning. We give the 4 years of medical school, then 3 up to a decade of residency, fellowship, all of the things that come forward, and it's never the right time. But our bodies are not on the same schedule. So look into things like freezing your eggs. Don't defer if you're at that point where you are ready to have a family to have it. Like there are rules and things in place where you can still thrive while in residency and fellowship with a family. And if you're not ready yet, look into those alternatives while you're at a great age.
That's it. I mean, my husband and I have 5 children, and I was always having a baby when I had a test. I felt like, right? A big milestone, right? An in-service training exam, otherwise known as the ITE, or a shelf exam, or a board exam, or an oral board exam, a written or oral board exam for emergency medicine. So I felt like it was always an inopportune time, but I'll tell you, I look at my kids now, all school age, and the timing was always perfect to bring in a life into the world. And it's those events that change you, and they change your demands, right? What's demanded upon you, it shifts versus someone who didn't have a child or is adding to their family, right? And so allow yourself the opportunity, save space for yourself. I wish I had told myself that earlier. People's like, oh, what is the one thing that you would have told your younger self? I wish I would have saved space for myself to feel those feelings and not try to shutter them, right? It's normal to feel a little bit stressed going back to work with the baby at home. That's normal. That's a normal feeling. We shouldn't try to quell that feeling. We should allow that feeling to be felt, right? And then once you feel the stress and you allow yourself to sit in that for a moment, you can feel comfortable in what's really in front of you instead of being afraid of it. And then when you get to that point, you can ask for help. I hope you ask for help if you do need help, right? Breastfeeding on shift. Emergency medicine is shift work. So that's one of the attractive things of the field, right? I was on and I was off. Nobody was ever going to call me on a pager. I was never going to be called off on the day that I was, not scheduled. And I love that about the field. However, it has its limitations when you switch back and forth the shifts, right? Nights, swing shifts, mornings, mid shifts, all those things, 4 p to 2 a.m. Those things are demanding on your body and on your schedule. And as you age and as you build your family, those are things that you want to let your spouse know or your significant other know. This is what my life is going to look like, right? For the next 20 plus, maybe longer years, that this is my daily norm. And so my husband adapted rather well to that. And maybe you need a nanny. Maybe you need someone to help you clean the house. Maybe you need someone to help with the laundry. Those kind of things, having those conversations early with your spouse, if emergency medicine is for you, is important.
Absolutely. So you mentioned that you've worked in different settings, in the military, you worked in academics, you worked in community health, but now you've just opened a mobile urgent care concierge practice. That is very exciting. Mm-hmm. Can you tell us about that?
I am thrilled. When I tell you, absolutely thrilled to share the launch of Houston's premier concierge mobile urgent care practice, Dash Health. So excited. This practice has allowed me to pivot in my career and in my life. The way medicine has gone for me now in the field, there's less time focused upon really connection, that connection we spoke about earlier. And more weight is placed upon seeing patients quicker, seeing them faster, not allowing that connection to develop. Now in emergency medicine, that's kind of been the norm, right? But now it's more patients per hour, all the things that the measurements of how fast we deliver care, right? The quality measurements and metrics that the hospital uses, right? And so that was limiting to me. I had to say, that's not really how I want to practice medicine every single day I go to work, right? I want to be able to sit. I want to be able to connect. I want to give the patients access that they need to care. I want to check up on patients. I want to give them the opportunity to follow up with me. Let me take your sutures out. I put them in, right? Mm-hmm. How are you doing after the pneumonia? Did the antibiotic regimen work? Were you able to get to the specialist? How the physical therapy go? Do we need another test? So the continuity was really important to me. Mm-hmm. And then being able to follow patients with their specialists and then throughout their disease process. I wanted to be able to do that. So Dash Health allows patients to be able to connect directly with me. They have my cell phone number, my email. They can text me through the HIPAA secure portal. They can send me secure pictures, those kind of things. How's the wound changing? I get to be a part of their care throughout the entire process, which I've missed. I've missed that aspect of what emergency medicine, is. And so the practice really enables me to connect with people and patients and give them the care they need whenever they need it, right? Whenever they need it. We go to their office, we go to their houses, we make house calls, we have telemedicine, we have specialists local in the community that we connect with directly. And if patients don't have insurance, that's okay too. I've contracted with, imaging and lab companies in the city to be able to get cash pricing for my patients for labs and things like that. And so it's been life-changing for me and for them, right? A lot of times patients don't have primary care doctors. So when they come to the ER and I see them and I treat them, it's like I just kind of set them back into the wild almost without any kind of follow-up. Mm-hmm. And I see that so frequently now in emergency medicine. And I didn't want that for my patients. I didn't want that. I didn't want to practice that way for them, right? And so this has allowed me so much more freedom.
That is so amazing. And it shows just how you can really shape your career any way you want to be. Mm-hmm. Just because I know when people think of traditional emergency room trained physicians, you think about being in a hospital setting or something like that. So just knowing that you can make your career your own with the skills and the training that you have and serve the patients in the capacity that you want to serve them.
It's been amazing and life-changing. And when patients, they say to me, I thought I was going to be up all night receiving all these calls. Mm-hmm. They're like, after you spent this 60 minutes with us, we were able to ask questions. Mm-hmm. We were able to share our concerns. We were able to talk to you. You were able to look at this and that. I had 5 complaints and you were able to answer, address them all, and that's everything.
Yes.
That's everything for them and for me. They left without any questions. They knew exactly what medicines they were taking. They got all their questions answered about the medications they're taking or they're on, about the other thing they wanted to ask. They didn't ask 2 weeks ago, and so it's really so much more clarity moving forward.
That seems like it's such a great model to look into. So as we come to a close, I love asking all of my guests this because we get so many different answers. If you had a magic wand and you wanted to change something about the healthcare system, because we know it's so perfect, what would you change?
Well, I would most likely change a patient's ability to access quality care. So many are uninsured, and once they're seen and diagnosed, they have a very hard time accessing the care they need to get well. And not even for treatment, yes, for that, for treatment, but just for overall wellness. We have so many diseases that are present that we don't realize that are terminal diseases, right? People usually don't think of diabetes as a terminal disease, but it is, right? Hypertension is one of those terminal diseases that, if gone unchecked, has significant sequelae, right? And so even these simple diagnoses, the patients don't have the access or don't have the awareness of the detriment of it going unchecked, right? And then getting access to quality care to address it. And just the lack of primary care doctors out there that in the field. We're losing so many physicians now to the healthcare system. We just need to be more diligent in getting patients through and getting them seen and evaluated and making them aware of how they can prevent. I always tell people, I'm interested in you having preventative care instead of the reactive care that we usually give, right? Let's prevent a lot of the illnesses and then get you through to be seen, evaluated, and treated. And that's the biggest barrier to me.
Absolutely. Access is so important because we can't intervene and help people if they can't get in. So we definitely have to increase the pipeline to get more physicians in place. We have to train people appropriately to manage teams. Healthcare is changing. So we have to figure out ways to adapt as physicians in order to lead in this new healthcare world. So it's
true.
An interesting spot we're in.
Absolutely.
I really thank you for coming and sharing all your pearls of wisdom with us. I want to give you an opportunity to tell the audience goodbye, as well as share information about your mobile clinic, where they can find it if they're in the Houston area, as well as your socials.
Thank you so much for having me, Dr. Erkeda. I'll tell you, I always have the excitement that comes when I'm able to talk to prospective students and residents about the field of medicine. It should still excite you. So give it all that you have early on in your career. And I'll just say it again, let it change you. Let it burn a fire inside of you that you're willing to serve your patients and yourself. And this career is a calling. And it's a blessing. It really is a blessing. I'm excited about being able to pivot in my career as an emergency physician into a concierge practice. I'm still practicing emergency medicine in the community, but this concierge business is giving me the opportunity to connect again and to feel the fire of emergency medicine again. And so you can find us at www.my-health. It's MYDASHHEALTH.com, my-health.com. Also on Instagram, you can find us at dash.health_HTX. And then send me an email. Feel free to email me or pick my brain. You can find me at info@my-health.com. All the words are spelled out. So info@my-health.com. And I'm happy to answer any questions. Like I said, shoot me a DM or an email, and good luck to you all in your journey.
Thank you so much for that. And for all the listeners out there, feel free to reach out and let us know if you have any questions. My Instagram is Dr. DOCTOR, the letter DGRAM. You can let us know any other topics or guests that you want us to invite. as well as just share this with your friends. We're on YouTube now, so you can go and see our facial expressions, all of those kinds of things. And I'll see you next week with another fantastic guest. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.